This is the second video in our series on hamstring injuries, and today I wanted to look at whether you should be stretching or strengthening the hamstring. The simple answer to that question is, first of all, it depends on whether the hamstring injury is sensitive to stretch or whether it's sensitive to applying load, and I'll explain to you what I mean by that now. When you get damage to the muscle fibers and they're trying to repair and join together, just like a scab on the skin if you have a skin injury, when you put a stretch through that area, you need to be careful that you're not actually tearing it apart, like scraping the scab off a skin injury. So with muscle injuries, whether it's the hamstring or any other area, you need to apply some controlled stretching through it to the point where you can feel some pressure on the area where the damage has occurred, but don't jerk it or push it, which will can suddenly cause minor damage or micro damage at the repair site, and then you cause more bleeding, and it's no different to the scenario we described with a scab on the skin. So overly vigorous stretching too early can be actually detrimental, and it keeps setting you back. Now, interestingly enough, some hamstrings tears aren't particularly sensitive to being stretched. We don't really know the reason for that. It's something that experts discuss and debate all the time. But some hamstring tears, when you put a stretch on the hamstring muscle, either by reaching down towards your toes, or if a clinician is doing this with your lying on the bed and bringing your leg up into a straightened position, sometimes the hamstring isn't particularly sensitive to stretching. And from a clinical point of view, if that's the case, then you don't really need to be spending time working on stretching. So the answer to the first part of the question, should you be stretching, it really depends on whether you're sensitive to stretching. And if that is the case, you need to do it in a controlled way, but mustn't be forceful, for one. Secondly, must not be sudden and jerky, because if you do that, and typically that happens if you're reaching down towards the toes, because you've got the full momentum of your body weight against it, and you can suddenly push too hard, and that causes a little bit of micro damage at the repair site. And then you're looking at having to settle things down for a couple of days till the repair occurs. So that's not a good way to try to stretch. So they would be the two most important things. The other thing that I would say is that when the tissues are warm and elastic, so if you've done a little bit of cardio work or gone for a walk or an exercise bike or something, which usually isn't too sore, even in the early stages of a hamstring injury, when the body is warm, the tissues are more elastic, and sometimes it allows you to stretch a bit further. But that's not always a good thing, because you mightn't be able to gauge what a safe level of stretch is. So I generally like to do the stretching when people are cold, or not excessively heated up, because that extra tissue elasticity can sometimes disguise that you're putting a bit too much pressure on the repair site. The third thing to monitor, or maybe it's the fourth now, is that the pressure you're feeling on the area where the damage has occurred should just be a nice stretch sensation, short of pain, but with a little bit of discomfort, but just a feeling of stretch sensation. That's a healthy level of stretch to apply. Anything more than that is potentially detrimental. Now, the reason you're doing that, you may say, well, why would you be stretching an area where it's trying to repair? Well, because as the fibers are damaged, the bleeding which occurs, which is part of any inflammatory response, it tends to be random, and the fibers that are trying to be repaired are laid down in a random crisscross manner. And what we want to do from a muscle repair point of view is to align and orientate the fibers so that they're running in the proper alignment that the muscle is anatomically structured to be in. So in the hamstring, it's from the buttock down towards the back of your knee. So if we have random scar tissue formation in a crisscross manner, then when you put pressure through the muscle, obviously it's much easier to damage it and repair it. So what you're trying to do clinically and with home exercise is to gradually reorientate the scar so that the fibers all become lined up in an up downwards direction from the base of the bottom or the ischial tuberosity into the back of the knee. That's very important, and you need to do that in a controlled way as the tissues are repairing. That's important. If you just leave it too long, you just get a solid lump of tissue, and then there's a lot more work and required to try and reorientate the tissues. So that's why you try to apply stretches within tolerance as early as possible. Now, the other thing you need to do, and we as clinicians always test for, is what's the load tolerance of the hamstring. And the hamstring muscle function in its simplest sense, if you're standing, is to bend the heel up towards the backside, so it bends the knee. So that's a very low load situation. So a hamstring that's acutely sore, sometimes just bending the heel up towards the buttock is sore, and then you've got a hamstring that's very sensitive to even light loads. But that usually subsides within a few days unless you've had a catastrophic hamstring injury. The next level of loading then is to look at bridging, which is a great exercise where you're lying on your back and just lifting the buttocks off the ground, and that works both the gluteal muscles in the buttock, but it works the hamstrings quite strongly as well. And I usually like to start this with the knees bent at 90 degrees. That's just a random safe starting point. And with two legs on the bed, your weight is shared evenly, so you get a sense of whether the hamstring is taking load well or not. Obviously, there's a potential to favour the good leg, so you need to have a look and see, is that happening? But the next then level of progression is to gradually reduce the weight on the good leg, so you can get a sense of what happens in the hamstring, the damaged hamstring, when it's loaded in a modest way. And when you're lying down, lifting on one leg, you're probably looking at about 30% of your body weight on the hamstring. So it's not a bad starting point, but radically less than how the hamstring will be loaded if you're sprinting, stopping, starting, changing direction, which is multiple times of body weight. So they're two important differentiations, because from a clinical point of view and from a home exercise point of view, it determines whether you prioritize going down a stretching route or whether you go down a muscle loading route. And it's not necessarily a complete either or, but generally a hamstring injury will be sort of more sensitive to one component or the other. So it helps you bias your treatment interventions and your home exercise protocols. Now, obviously, this is still very much in the first aid phase, so it's modest levels of loading, both stretching and strengthening, and we need to progress beyond those. So in the next video series, we look at some of the progressions on these to try and transition you from the acute and subacute phases into the rehabilitation phases. Hope you enjoyed the video. If you did, please give us a thumbs up on our YouTube channel, and feel free to subscribe so that you'll get our regular updates, which we do weekly. I'm David Fitzgerald from Dublin Physiotherapy Clinic. I've been treating these kind of conditions for 31 years now, so we've seen quite a few of these, and hopefully I can give you some useful information. I'll see you again on another video. Bye for now.